My name is Sandro Galea. I serve as Dean of the WashU School of Public Health. Welcome to Public Health Ideas. These conversations aim to highlight work that advances the science of health. Today, I have the privilege of speaking with Professor Mark Fiala. Mark is an assistant professor of medicine in Division of Oncology at the WashU School of Medicine, secondarily appointed at the WashU School of Public Health. Mark, welcome.
Thanks for having me.
So talk us through some of your work. You study cancer health disparities among different populations. Talk us through what you study.
Yeah, my research focuses on how the social characteristics, what a person looks like, how much income they make, where they live, drives what their cancer outcomes are.
So talk us through some of the key barriers to cancer prevention, cancer care, particularly for underserved populations.
Yeah, so ultimately it starts with an access issue. Some people just don't have access to quality health care around their home. Other people might technically have access, but the financial burden can be so hard that it acts as a barrier to their care. Moreover, there's a lack of trust in the healthcare system, and some people see healthcare as kind of a measure of last resort and not part of their normal routine life.
Let's talk about data. So what are the challenges in collecting and analyzing data to be able to document cancer health gaps?
Unfortunately, the data is often missing. We often have clinical histories, but we lack the cultural and social context that the patient lives in that helps drive their access to care and their cancer outcomes. So oftentimes we're using proxy measures to try to estimate these things. And these proxies are just not great estimates for that. And oftentimes we're trying to take large data sets from desperate resources and merge them together to try to answer these complex questions, because the data, like one comprehensive data set does not exist to be able to answer these questions.
I think the work you do has national and global implications, but talk us through the local context. What's the landscape of cancer care and cancer disparities here in Missouri?
In Missouri, we face disparities on two different fronts. So first, we see stark disparities based on race and ethnicity in cancer outcomes and access to treatment. But at the same time, we see that people who live in rural areas, which is about a third of Missouri residents, just don't have access to health care. And people who live in these areas could spend several hours just to see a specialist. So intervention strategies need to be multifaceted and comprehensive, because what might reduce disparities based on race and socioeconomic status might not be able to address disparities based on access and geography.
Now, when we talk about disparities, sometimes I worry that we talk only about the problems. So talk us through some solutions. So what initiatives or programs have been successful in addressing or reducing cancer health disparities?
Yeah. Some of the most successful innovations thus far have been targeting the barriers to accessing care. So first off, improving insurance access and comprehensiveness of insurance. People who don't have insurance are less likely to get cancer screening and cancer care. But insurance itself does not alleviate all issues. And therefore, things like patient navigation, where patient navigators work with patients to reduce and alleviate the other barriers to care, things like transportation issues, have shown meaningful benefits to help patients navigate the complex healthcare system.
How about community-based interventions? Where do communities fit in, and how do we integrate communities into interventions to narrow cancer gaps?
Yeah, so community-based interventions kind of turn the model on its head, where instead of asking patients to fit into our structure, being researchers and healthcare providers, we start with trying to bring our solutions closer to home. And we work with community agencies to have a better idea of what the needs are and what the strengths are of these communities to try to address those goals. So by doing so, not only do we come up with potentially better interventions, but we help build trust by working with these agencies that these community members have a long-standing relationship with versus something that the hospital system is trying to do on its own.
Let me pick up on trust, because you mentioned trust. So how can healthcare providers improve communication and trust, particularly with patients from a broad range of backgrounds?
Yeah. So trust really starts with removing the expert label. from researchers and healthcare providers, and really becoming active listeners. We're not there to hand out a pamphlet or to provide a diagnosis. By really understanding the complex social and cultural implications that a patient may face, and to have a better understanding of the clinical context of their disease, we can make better recommendations that'll fit the patient's lifestyle. So really engaging in this bidirectional feedback, we can become partners in healthcare, and that can help alleviate mistrust, improve trust, and by doing so, reduce cancer disparities.
Because we're talking in 2026, I feel like I have to ask you this. How do you feel about AI and cancer care? Is it a game changer or is it mostly hype?
AI has tremendous potential, but it's not a cure-all. It can take massively large data sets and recognize patterns that would be difficult for humans to understand. But if these models are trained on data that are incomplete and don't represent the communities we serve, it has the potential to only contribute to the disparities that we face. So we really need to be mindful when we develop these and integrate them into our healthcare to make sure that we're improving the problem and not potentially exacerbating it.
Policy. So what policy changes, if you had a magic wand, would we implement to better address cancer health disparities? And what are some of the challenges and opportunities around such policy making right now?
So first, we need to improve access to healthcare insurance. Without healthcare, it is difficult for people to access cancer screening and cancer care. Secondly, we need to look for innovative ways to deliver healthcare in a more efficient way for individuals. Utilizing innovative services like mobile screening units or mobile treatment administration units can bring care closer to patients' home. And lastly, we need to improve representation in clinical research. Too often, our treatment advances developed with data that doesn't really reflect the communities that we serve.
Last question, ending on a positive note. What gives you hope in the moment?
What gives me hope is the improvements that I've already seen over my career. Just over the past 10 years, we've seen the rate of uninsured Americans drop by nearly half. Insurances can no longer disqualify people due to pre-existing conditions. This has improved access to care for millions of Americans. And moreover, we're seeing cancer disparities improve in recent years.
Mark, thank you for the work you're doing. Thank you for joining this conversation.
Thank you.